Hello friends, I am Dr. Hiten Karelia. I am infectious disease specialist in Vadodara city. My friends are frequently asking me about the OPD services and the IPD services during this lockdown period in the corona epidemic. So I thought to make this video for the suggestions for those people who want to continue their OPD and IPD services. First of all, for IPD services, the government has selected some hospitals for the indoor services for the corona, and we should refer them to those hospitals only. But as a practitioner, we are getting such kind of patients in our OPD. So should we take such kind of patient in our OPD or not? So for that, the first thing is that the OPD infrastructure. We should ask certain questions to ourselves that our OPD, the waiting room is good, airy, is it having the space to keep distance between two patients of around 1 meter? That are the questions we should ask. We should have some fan in our OPD because we need not to have a congested cold air in our OPD waiting room because it may spread the virus locally. So we should have some air changes in our OPD waiting area to avoid the infections. We should have the services of the sanitizer. We should give masks to each and every patient who is coughing and entering in our OPD, and all patients should wash their hand with the sterilium, right? We should have one area, we can label it as a flu corner or a triage area in our OPD, where a medical officer or a medical staff which ask the patient a brief history, saying that the patient is a traveler, saying that the patient having any complaint of the respiratory infection like cough, breathlessness or fever. If the patient having such kind of history, they should inform us on a phone that this guy having this kind of complaints. So then we should decide that should we shift the patient to the government or should we examine the patient with the personal protective equipment or not. So again, that is a question. You should have the personal protective equipment in form of the goggles, in form of the mask, which is N95 mask, and the proper gown. If you have that thing and if you have the suspected corona, then only you can examine that patient in your OPD and go ahead, right? Another thing, one more thing, the relatives are also coming with the patient who is coughing and having fever. So we should not allow all relatives to come together in our cabin or in our OPD. Maximum at the time of the appointment, we should ask them to tell only one relative or a patient himself alone should come to your OPD to avoid the transmission to the relative as well as our staff and ourselves. Second thing, in our cabin, once the patient is in cabin, I agree that our cabin will be a very tidy and clean, but the position of the air conditioner should be behind us so that the airflow is coming from the AC will go toward the patient, not from the patient it will come to us. So by that we can avoid some droplet infection. If the patient is coughing and not having mask, then we should not get infected ourselves. So the position of AC, you can also keep a standing fan in your OP or outpatient department. Plus you should keep a mask on your mouth and the nose, which is mandatory for all clinicians who is doing OPD during this pandemic. As well as we should keep some assistant inside the OPD who can help us out during the auscultation or during taking blood pressure or examining the patient. Don't forget to clean your hand by after each and every move when you are examining the patient with the cleaning with the sterilium. One more thing, that please keep distance. No need to keep the patient just beside you and the auscultate frequently. You can keep the distance at least 3 feet. You can keep the patient on the examination bed, take the history, and when required you can go in to the patient and examine the patient, right? Another thing, what to go ahead, how to go ahead for admission. My suggestion is that we should, go back to our medical school and, we should diagnose the patient on the syndromic approach. Like if the patient having certain symptoms, then this system is involved. Like the patient having some GI, some complaints and the fever and all, most probably the patient is suffering from some GI infection. But yes, the patient having some cardiac history in the past, if he has a breathlessness or exertion, he might have some cardiac illness for the cough and this breathlessness. So we should go on the syndromic based. If the patient having some cardiorespiratory cause for his illness, we should triage that patient. We should shift that patient to the hospital where such kind of patient sort of corona is treated. And another questions, many of my colleagues are asking me that okay, we are sending the patient to XYZ hospital or maybe government hospital where they are not doing tests and saying that the patient doesn't look like of corona, and they are sending back the patient home, and their patient is going home, and then on second or third day the patient again comes to you. So at that time I believe that the appointment system or the person who is giving appointment should be given a training that asks the patient about where he went to another hospital, for what purpose he went to another hospital, any suspected corona symptoms he is having or not. So these are the things our appointment person can ask and inform us, and on that basis we can go ahead. Yes, many patients are hiding the travel history. At that time we have to be tactful to ask the patient that where he was in past 15 days or past 1 month. You can ask the relative, you can cross check with the relatives and all that. So it is, I know it's quite cumbersome, but we have to act like that if we want to continue the OPD. One more thing, when we are referring the patient to the government setup, at that time we should have the all detail of the patient, a correct detail of the patient, which includes the phone number, which includes the address, alternate phone numbers for the geographical knowledge. If the patient become corona positive later on, then to trace that things, it will be easier for the epidemiologist. So when we are having the patient, we should have an exact number and the details of the patient. And when we are sending him to government, at that time write on your letterhead the details of the history which patient is giving, your findings, and write a note to the concerned medical officer in the government that I am suspecting that this patient might have corona. Please do the needful and inform back to yourself, so that the patient comes to you after 2 or 3 days. You can be aware of the fact that patient went there, he was given some antibiotic, he was given some sort of syrup, or the patient was asked for the home quarantine. So we have to also be quite vigilant about the thing that what happened to the patient when we are sending him to government. And I think we should have a good rapport with the government guys, so that we can check out that the patient is going for quarantine or patient is not following the quarantine and coming back to you. So this is very important thing which I want to discuss with you. I think again next 2-3 videos I will coming with the certain common case scenario which we have to deal in our day-to-day practice. Thank you very much.